So systemic mastocytosis is one of the myeloproliferative neoplasms. It's one of the ones we don't talk about quite as much, but it really can be highly problematic. That overclonal proliferation of mast cells can impact patients in a whole variety of ways, both in terms of symptoms, organ dysfunction, etc. As you know, my team and I have long been very interested in understanding the disease burden for patients that have myeloproliferative neoplasms. And colleagues such as Jason Gottlieb, Deepi Radia, and others have looked at the symptom burden in these patients and found that they are quite symptomatic, and many of them are even more symptomatic than individuals with myelofibrosis, PV, or ET, other areas where we've done extensive research in terms of symptom burden. Now, it's a period of time where we have more options for mastocytosis, which makes it an interesting time for us to better understand the disease. Indeed, there are new therapies that are targeted against the KIT mutation, BLU225, that have shown very impactful data, some of which will be presented at this year's ASH meeting regarding efficacy and safety for people with advanced systemic mastocytosis, with other trials in indolent mastocytosis upcoming. Now, I was tasked with presenting data from a collaborative project that was a TouchStone survey that had two parts and two abstracts that we presented. The first was regarding healthcare providers' perceptions of systemic mastocytosis. And in this survey research, and we had both patients, patient advocates, physicians, both allergists, myself as a hematologist, involved with these efforts. So first, interestingly, surveying physicians, one, in community practice, they found the presence of the KIT D816V mutation to be less than frequently reported. And that's something that we look forward to looking into further. They certainly shared that their treatment goals for both advanced and non-advanced SM patients to be improved quality of life, but also improvement in overall and progression-free survival. They did find that many patients with indolent systemic mastocytosis do have a lot of symptoms and disease burden, and there is not infrequently difficulties with depression associated with this. It is clearly thought that this disease is one that requires team-based care, and that there's both a role for us as hematologists and allergists and immunologists in the care of these patients. And that future studies in terms of better understanding these healthcare provider perceptions are important. Now, in parallel, we performed there was a survey included impact from patients as well. And it was found, not surprisingly, in my experience treating many of these patients, that their symptoms from the disease can have a significant negative impact on their ability to work and perform usual activities. And that when using standardized questionnaires, their physical functioning and mental health can be inferior to that of individuals even with advanced solid tumors, such as colorectal cancer or lung cancer. Patients report significant healthcare utilization, frequent physician visits, frequent supportive medications, and frequent anaphylactic reactions that can be incredibly both threatening and disruptive for these individuals. So we look forward to learning more about the disease and how these patients are afflicted. I will share with you one key takeaway is that individuals that have still a more latent prognosis, indolent disease, etc., although they don't have severe organ dysfunction, they have tremendous difficulty with their symptoms and anaphylactic reactions still. And this suggests that, again, the disease burden might suggest that we need to potentially in the future rethink treatment paradigms, which have been primarily focused on patients with very advanced